Why do we see these kind of abnormal scars in few people? What are they called and what are the treatment options available? I am Dr. Vasavi from Vasavi Skin Center, Bangalore. Sometimes whenever we have any minor cut or injury, it heals with raised thick scar tissue. This is called keloid. Keloid occurs due to formation of excess of scar tissue, which is a result of abnormal wound healing. How does a keloid form? Whenever we have any cut or injury, the process of wound healing starts. The first step is hemostasis or the clot formation, and the second step is inflammation, where all our white blood cells will come to the point of injury and will start producing growth factors. Third step is proliferation, multiplication of the blood cells, skin cells, and all the collagen and other tissue happens. Final stage is remodeling stage. During this stage, whatever excess tissue which has been formed is degraded and contracture of the wound will happen. So if at all there is any deviation in any of this process, will be leading to excess of scar tissue and then keloid. Who will develop keloids? Keloids can occur at any age group. Certain people who are genetically susceptible are at more risk of developing keloids. How to recognize it early? Whenever we have any cut or the injury, whether it could be post accidents or burns, post surgeries or post piercing of the ears or the nose or post healing of the acne, during the process of the healing, if you develop a nodule which is growing in size beyond the site of the injury, that is called keloid. Keloids may be associated with itching, pain or sensitivity of that nodule. That indicates the keloid is actively growing and you must consult a doctor. What are the common sites involved? Keloids usually develop at the place where skin is under constant stress, like the sternum and the shoulders. Sometimes acne can also heal with keloid scars. After piercing of the ear or nose, we may notice a thick nodule developing at the site of piercing area. So these are keloids which can grow to a size of big lump that needs surgical excision. What are the treatment options available? Since inflammation is the primary factor which is stimulating excess scar tissue production, to reduce that, intralesional steroid injection is given. So these injections will help in suppression of the keloid. They can be taken once a month. Depending on the thickness and activity of the keloid, 2 to 4 injections can be given. Intralesional steroid injection can be combined with fractional CO2 laser or cryotherapy to reduce the bulk of the keloid. In cryotherapy, liquid nitrogen is used to freeze the keloid tissue to minus 22 degrees. That destroys the tissue and also helps in preventing the recurrence of keloid. Certain supportive therapies like occlusive dressings and compressive bandage is important in preventing the recurrence of keloid. This helps in reducing the blood supply to the keloid and prevents from recurrence.